think designing a care pathway is very, very complex. I think you need a lot of patience, because when you get your right people, when you find your clinical engagement superstars, they've all got a lot to say, but it's about drawing all of that good evidence for practice, people who can talk about safety, quality and experience, people who don't only talk about experience of the people who receive care, but the people who are delivering the care, so the workforce as well. I think you need all of those components to design a care pathway, but let your start and finish point reflect good evidence.
I think it's essential that we engage with frontline practitioners, because they are the people who are going to be doing the work. There's no point in us having discussions within our pathway of care working group if we can't sort of take some of that energy, enthusiasm back out into the community and actually make some real changes in the way that people are working. So really important that we can just get that clear message out of the boardroom, if you like, and into the community.
I think that work that we're doing is helping to deliver better patient care, because we're linking up primary and secondary care much better than it has been. The focus has always been to link health and social care together, and in these kind of, the way it's being delivered is you've got all disciplines coming together, rather than the medical team doing it one way, the social team doing it somewhere else. It's now all linked together. So you looked at people's needs more holistically. You're not just looking at their medical needs, you're looking at their lifestyle, their families, everything else of what else it's needed to deliver good and proactive care. And it's working well because everyone is being listened to, and their visions and what they see is being taken on board and acted on.
I think the link between the strategy and what we do on a day-to-day basis is that we are trying to provide a better quality of care for everybody in a care home, and within our jobs we're trying to provide a better level of care for each older person that we come across. What we've tried to do with this programme is share a very patient-centred approach and kind of educate people as to looking first at the person and what their individual needs are, rather than how they fit into your individual boxes. It makes it much more holistic and streamlined for the patient. Our whole ethos is about getting people to come together around that person so that we can bring together all the things that they need in one place. With the MDTs we do that in bringing together kind of mental health, physical health, other agencies, therapists. It's a bit like an MDT but for each individual person rather than in one care setting.
Yeah, and I'd agree that very much that holistic ethos and trying to regard everybody as part of the care team around that individual. Yeah. So it's not just about doctors and nurses from primary or secondary care. It's very much about the people working in the care home. It's about the individual and their family. Yeah. And that the strategy or the work we're trying to do is trying to bring everybody together in that sort of mindset.
Obviously strategy is critical because we're talking about delivering long-term change. We've got an ageing population and a greater reliance on care homes with much more people with advanced levels of frailty and mental health issues like dementia. So what this group is doing through Vanguard is actually translating high-level strategy into specific actions, changing the way nurses work, changing the way GPs work, changing the way care homes work, creating champions within care homes to relate back to the teams, and also how the voluntary sector fits within that. And one of the key themes, I think, about making strategy live is this phrase that we've coined, which is moving into either a care home or a nursing home is just a change of address. And that's what we need to think about. It's just a change of address. And the services that people had before, they still need them.
I think it's would be really beneficial for other care systems to adopt this approach to system redesign and service delivery, because we all know that we live in a really challenging time when we have a growing ageing population and a very limited public purse. And I think that you can only really spend that money once, and we've got to spend it really wisely. So by pooling our kind of energy and resources and the skills of the clinical staff right at the front line together to think together and design services together, then we are going to get the best outcomes for patients, but also importantly, you know, making sure that we're delivering value services.